When you look back to, when some of these long-acting narcotics first became available 12, 15 years ago, and some of the physicians who promoted these, they really believed that these were a safe way to treat chronic pain, that very few people would become addicted, that dosages would not get, quote, out of control. And those of us in the addiction field at that time knew that this would become a problem. I don't think any of us saw how big a problem it would become. I think what we're seeing is the after effect of promoting these medications as being safe and non-addictive for most people, which simply isn't true. One of the things that we try and teach in part of our educational and therapeutic is that this is a medical illness. It isn't something that somebody wanted. I mean, I don't know anybody that wants to get cancer or wants to get diabetes. If you have the genetic tendency and you use enough of these medications, even for a legitimate medical purpose, you probably become addicted. And it is unintentional, and it's not a character failing. It's an illness, and specifically, it's a brain disease. There's a phenomenon called tolerance. And what tolerance means is that it takes more of the drug over time to produce the same effect, or you get less benefit if you stay at the same dose. And so it's very easy to become tolerant and everybody had always thought medically that, well, if you develop tolerance, then you're safe at these higher doses because your body's tolerant to it. But what happens is you get to these real high doses, like 600 milligrams of oxycodone or hydrocodone a day, your margin of safety disappears. And so what happens is, all of a sudden, you're taking your normal dose, but you have the flu, or you're really dehydrated, or you're under some other medical or physical stress, and now your normal dose is an overdose. And sometimes it's a fatal overdose. And we've seen, just as we're seeing an epidemic of prescription drug abuse and addiction, we're also seeing an epidemic of prescription drug overdose and death.